You are the CEO of a very large and influential hospital, but before that, you were a physician. Explain to us, as a physician, how did we get here?
Well, we got here through a series of a lot of mistakes, overprescribing of the opioids, OxyContin, and things of that nature, creating pain alleviation as a top priority of hospitals so that we were really prescribing a lot of these things. And then getting to the point where we were using them for purposes that they were never meant to be used for. Chronic pain and cancer is one thing. Having your wisdom teeth taken out is another. And that just perpetuated itself. So it's taken us about 20 years to get here, and we've got a long recovery road to get back to where we need to get back to as a country.
Well, let's talk about some practical things that can be done.
Sure.
We had Eric Schneiderman, the Attorney General of New York State, in a little earlier this month, and he said one of the things New York is really working on is limiting the number of pills you get prescribed the first time.
Yes.
Something that actually the President referred to CVS is doing. So you only get 7 instead of 50 or something. Do you have that experience at New York-Presbyterian?
Absolutely, and we're monitoring now opioid prescribing habits of every one of our physicians so that we can detect an anomaly where somebody is overprescribing and needs to be trained, or overprescribing and we need to say, hey, cut it out. So that's one thing. We also have a lot of programs in place to be able to, if somebody comes into the emergency room with an overdose, to get them the help that they need, not just reverse the overdose.
Another thing that some people are talking about, and again, we're going to play here what Eric Schneiderman had to say, is really monitoring how these things are being prescribed, keeping track of how many pills people are getting. This is what he had to say earlier this month.
I think that there are different states now experimenting with other prescription monitoring programs. I happen to think iStop is the best. It's been highly praised. If we had a national iStop program, that would be fantastic. And if every doctor and pharmacist across the country had to consult a database before either writing a prescription or filling a prescription, we saw doctor shopping fall by 90% in New York. That'd be magnificent if we could do that across the whole country. But I do think that there is room for federal action. And I think that the crisis is severe enough. And this is something that is not and should not be a partisan issue.
So what about that, a national way of monitoring how many times these things are being prescribed for people?
I think this is a terrific idea, and the program in New York has worked very well. But I want to stress something. Not prescribing these prevents future addiction. We've got a major addiction problem in this country right now. 50,000 Americans each year are losing their lives. We now have an influx of fentanyl and heroin, so that even if you don't get the opioid, you can get the synthetic version of this. So we've got a lot of things to do on the treatment side as well as the prevention side.